So I've kind of spread out these little handouts, which is going to be what we're going to be talking about. We're kind of going to go over some of the basic framework for DBT, and then we're going to do a brief overview of each of the modules and what skills fall under them. So to start, DBT is kind of a different form of therapy because it holds these assumptions, and everyone who partakes in this therapy hold these as true. So we work really hard to keep them in mind and apply them to our patients as we work with them. And the first assumption is that patients are doing the best they can. So at any given moment, they are doing their best. However, there are often times when you can't actually see it, and this is due to the fact that they're struggling. And it's helpful to just kind of keep in mind that everyone's experience is different. So for someone who is struggling with depression and is having a hard time like getting out of bed, it can look very differently for them versus someone who is struggling with like focusing at school and getting work done. And so we kind of hold in our mind that people are doing the best that they can at any given moment. The second piece of it is that patients want to improve. Patients are often so used to hearing that their behavior failures and difficulties with therapy stem from a lack of motivation within themselves. And we try to keep in mind that there are things that get in the way for people to do things. There are times where everyone just is unmotivated, whether it's to go to work, finish a paper, go to class, stuff like that happens. So we hold in our mind that patients want to improve. And at the same time, while we hold these first two principles, we're balancing that out with keeping in mind that patients need to do better, try harder, and be more motivated to change. And that even though it might seem like it goes against the first two principles, with DBT, you hear a lot about dialectics, and this is a place where dialectics also comes in. And so you want to keep in mind that while they have these therapeutic goals, it might be hard for them to actually accomplish them. And so it's kind of the job of the therapist and whatever other milieu staff may be around, or it could just be the therapist, to help the patient with getting more motivated and trying harder. We also hold the other tenet that while patients might have not caused all of their problems, and at the same time, they're in the position of having to fix them anyway. And this can be a really tough one for patients to hear. I run groups over on the intensive unit, which is our 3 program that has like a 4 to 6 week of just intensive DBT. And this one tends to be the one where they get stuck on, because a lot of the times they feel that, you know, this isn't fair, that what's happened to them isn't fair, that they haven't caused this. And it's hard to look at it as, while you might not have caused it, it's still your responsibility. Like, this is their life, and they need to take the steps in order to change it. We can't do that for them. Which goes into DBT in general just being a therapy where people have to be committed to the therapy in order for it to work. We can't make people change. So we really try to emphasize the fact that while they might not have caused all their problems, they're the ones in the position to solve it. No one else can do it for them. We also hold in mind that their lives are often unbearable. We often say that's like living hell, because it's hard. It's hard when you can't regulate your emotions. It's hard when you constantly feel flooded. It's hard when you can't think straight or focus on anything, It's hard when you want people to be close to you and all you can do is push them away. Like, it's hard to live that way. And to want to have goals and dreams that you can't reach and feel stuck and unable to meet them. And we really try to hold in mind that their life is hell, and no one willingly wants to kind of stay in hell. People kind of don't know how to get out of it, which makes sense, because a lot of the times we aren't really taught how to manage our life outside of just the general, like, this is what you do and this is what you don't do. You don't really get roadmaps to figuring out all little bumps that come up. And we also hold the tenet that patients have to learn new behaviors in all relative contexts. So this means not just learning it in therapy, but learning it outside of therapy and being able to apply it, whether it's in school, whether it's at home, or in the program itself. Learning how to use those skills in all of those places is really what we try to push for them to do so that it works. It's not just something that works while they're in the program, or it's not just something that works when they're in therapy in that office. We want it to be something that works for them all the time. We also hold the tenet that patients cannot fail in therapy. And this is another one that is hard for patients to sit with. We tend to, just in general as society, view either success or failure, and it's very black and white like that. What we look at it as is that if patients are doing the best they can, and they are trying, and DBT is not necessarily for everyone. It was made very specifically for like BPD. So it might be the case that DBT fails for some people. And there are other therapies that are better. So CBT is like really great for depression. And like that's great. So there are treatment methods that work for people that are more effective, and there are some that don't. And it's not the fault of the patient that it didn't work. It just means that they have other needs, and there might be another therapeutic modality that works better for them. And trying to find that versus keeping them stuck in DBT and trying to make it work when it doesn't fit their needs. And the last tenet is that therapists also need support. It can be just hard working with the population and being able to just be mindful of your own limits and get support around what's happening. It also allows for the therapist to be held accountable to the treatment. So everyone who participates in DBT therapy has to be part of a consultation team. And this is where the therapists are kind of held accountable to the treatment, the assumptions, and the modality of the way that it's supposed to be taught for the residents. So when we're looking at DBT, dialectics is the first thing that comes up. And when we're talking about what is a dialectic, we're looking at like two seemingly opposite things that are true and holding them both true at the same time. So someone could want to get better and at the same time be afraid to get better. It's hard. It's different. You're doing a lot of things that you haven't done before, and it makes a lot of sense to not want to be in hell and at the same time be scared to get out of it. Sometimes it can be comfortable to be in what you know versus to step out of your comfort zone and to try something differently. So we really encourage our patients to try to think more dialectically, because it can also help with just reducing suffering if you're able to think of situations in a more dialectical stance. And with dialectics, you're really focusing on like finding the middle path between two extremes. So you want to try to balance what's happening for you and not place judgments on what's happening. So it's not, there's something wrong with me because I want to stay sick, or whatever the thought might come up. It's that it's hard to change and it's hard to do things differently, and that is what it is. There's not much more to it than that. And with the goal of dialectical thinking is to kind of diminish the right-wrong kind of thinking and have it be more gray. So you think more in shades of gray. There isn't necessarily a right answer, there isn't a wrong answer. And it's not either or. We instead like to use a lot of both and. You know, on our unit, we've kind of eliminated the word but from our vocabulary. Because while there are some instances where but can be used, but tends to contradict everything that you just said before it. You know, so when you might be talking to someone and you're saying, yeah, I know you're having a hard time, but you still have to go to school, it kind of makes it seem like, well, I don't really care that you're having a hard time, I'm more focused on you going to school. Whereas if you can phrase it more like, it makes a lot of sense that this is hard for you, and I think it's really important for you to go to school. I know it's something that you're working on, and I want to be able to help you do that. It sounds a lot different, and it feels a lot different for the person who's hearing it. So we really try to encourage our residents to kind of get rid of but and instead embrace and. Because it feels a lot less harsh when you have and versus but. So Marsha also developed this biosocial theory for emotional dysregulation, which kind of helps explain how BPD is emerged. And so what we have is someone's emotional vulnerability, which is just their biological predisposition. This is how they are born. There's nothing they can do about it. It's not necessarily hereditary. It's just the way that it is. So someone can be born who is just more sensitive, who's more reactive, and who has a harder time just coming back down from their emotions once they experience them. And people run across this whole spectrum of either having high, medium, or low reactivity and sensitivity and like a return to baseline. It's different for everyone. With people who have BPD, it turns out more often than not that they have a high sensitivity and a high reactivity. And when you mix that with an invalidating environment, it's kind of what creates the emergence of BPD. So with the invalidating environment, there are kind of three characteristics that fall under it. And a lot of the times, I'm a parent, and so sometimes when I started learning about this stuff initially, in my head I was thinking, holy shit, I am messing up my son. Like,
you just totally swore.
I did, my bad. I'm like, oh goodness. Like, I've invalidated him, he's like gonna end up needing all this help, like I've just messed up as a parent. And the reality is that we are going to invalidate our children, whether we mean to or not. I think what's important is recognizing when it does happen so that you can do something about it. Because a lot of the times, if we don't have the awareness around what we're doing in terms of our behavior and how we're talking and the effect it has on others, it's very hard to do something differently about it. You can't change what you don't know. So kind of easing up on yourself and giving yourself a break in terms of what you can't change and instead focusing on what you can do now. Because, being a parent is hard, period. While there are many books, there's no real way of doing it. It all depends on your child, and everyone's child is different. Everyone's needs are different. So with the invalidating environment, a lot of the times what happens is that people's private experiences, they're not taken as valid. And instead, they are like either punished or trivialized, dismissed, or disregarded, or they're attributed to socially unacceptable behaviors. So it could be that, let's say your daughter's having a hard time at school, and you really want her to do well. And you always did well in school, and you don't understand why this is so hard for her. It could be that when she comes to you and says, I'm having a really hard time, I don't understand this, your response might be, it's not a big deal, like I know it might seem hard, but you just need to focus on what you're doing and it'll be all right. And it's not really acknowledging what her internal experience is, which is that this is in fact hard for her. And while it might not seem like it's difficult, and while it might have been easier for you or for her brother or whoever else is in the family, for her, it's something that is hard. So there are three forms, three characteristics of the invalidating environment. So first, we have indiscriminately rejecting communication of private experiences and self-initiated behavior. So what this can look like a lot is when, let's say, your daughter's boyfriend broke up with her, and she's like sobbing. And it's hard to see someone that you care about suffer and not be able to do something about it. And it's very easy to want to fix it. If you were to approach her and be like, you don't have to cry, there's going to be so many other people that will be interested in you, don't you worry about it, there's so many other fish in the sea, then while that might be true, because chances are, when someone's 15, they haven't found the love of their life, At the same time, it's not helpful for that person in the moment. And what ends up happening is that it makes it hard for the individual to know that what they're feeling is okay. So if they're feeling sad and you're telling them, no, 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 don't be sad, then it's hard for them to understand, when is it okay for me to be sad? Like, when does that make sense? Whereas if you were to approach the situation and say, I can understand why this is hard for you, like, this is really sad, and like just kind of sit with that versus trying to fix it, it actually pays attention to what the emotional experience is. And it's hard to do. Like I said, we want to help the people that we care about. And at the same time, sometimes doing nothing is just as helpful as doing something. So the second characteristic is consequences of intermittent reinforcement of escalated emotional displays. And what this means is that there'll be times when you say something is okay, and then there'll be other times when you say it's not. So let's say curfew is at 9, and they show up at the house and it's like 9:30. And you're like, oh, it's not a big deal, like this happens, it's all right. The next day they show up at the same time, but maybe you had a harder day that day, maybe you got into an argument with someone, who knows, a lot of things happen. And for some reason, you instead respond by saying, this isn't okay, I'm grounding you for the rest of the week, you can't go out. So on the one hand, they're like, what? I thought this was fine. And on the other hand, it's like, wait, no, now I'm in trouble. Like, what do I do? And what ends up happening is when this keeps on happening, they're being told one thing one time, told another thing another time. It's really hard for them to be able to communicate what it is that's happening for them internally, because they don't know what to expect from you. They don't know if it will be okay. And they don't understand like why it's different now versus why it wasn't different before. So trying to like pay attention to those moments where you might have said it was okay one time and another time you're changing it, and just being mindful of whether or not 9:30 is a big deal or whether or not it's not. And last, we have an oversimplification of life's problems. And this is where, the individual just starts to learn to just invalidate their own internal experience. So if someone is at school and they have a hard time with like math or history or science, but they see everyone else around them seems like they're doing it and it's fine, they'll start telling themselves, like, why is this so hard for me? This shouldn't be hard for me. Like, everyone else does this. This shouldn't be a big deal. And it's like that invalidation of what their experience is. Because it can be hard. It's not easy for everyone. And feeling that can be okay is important, because what ends up happening when people just constantly like oversimplify what their problems are is that they don't know how to tolerate the distress in life, because they can't like rebound from things not going a certain way. So if everything doesn't go as it is expected, it's very hard to know like how to problem solve around it. And so it's this transaction between the emotional vulnerability and the invalidating environment that makes it hard for people to learn how to label and identify their emotions, learn how to tolerate their emotional distress, learn how to trust their own emotional responses, and develop like a coherent and resilient sense of self. So it can be, it's hard stuff for people to try to manage. It's definitely not easy. So Marcia created these levels of validation to kind of help people feel more understood around what's happening for them. And there are some of these that work really well with some people, and there are some that will send people right off the deep end. And they're like, oh, why are you talking to me like that? That's not helpful. I don't want to hear from you. And they'll just like kind of close you out. So first and foremost, we have staying awake. Pretty basic. You got to be making eye contact and awake to let people know that you're listening and like alert to what's happening for you. Then there's reflecting what the person has said. And this is just kind of parroting, repeating back whatever it is that they're saying in your own words. So if they've said, I had a really hard time today, my best friend got mad at me and I just don't know what to do, I just feel so sad, saying something like, it sounds like you're feeling really sad right now. I can see why that's hard for you. I know that your friend's important to you. And you're just kind of repeating back what they're saying. And a lot of times people just feel heard and understood. Then we have given voice to the unspoken. And this is where you're bringing to light what they aren't saying. So we had a resident today sharing group that one of her best friends got really mad at her and said that he didn't want to talk to her again and ended the relationship. And she was stuck trying to figure out how to connect with him. And so we spent some time talking about what could be going on for him, what he could be thinking. And we ended up with the conclusion that, we let him have some space because there was, a little disagreement that happened and it seemed like he needed some space. And that after, waiting a couple days, she would send him a message where, so what he said was that, I am angry with you, I don't want to talk to you, I'm not your friend anymore. And what she's going to respond to is with, I didn't mean to make it seem like you weren't important to me. I didn't mean to make it seem like our friendship wasn't important. It is important, and I hope that we can figure out a way to work this out. So he was reacting to a conflict that happened between them where he felt that she should have told him something because they're best friends. And that's what best friends do. But he wasn't actually saying I am hurt and sad that you told someone else something before you told me, or that I had to hear this from someone else. What he's saying is, I don't want to talk to you, I don't want to be your friend. So giving voice to what isn't being said can be very validating for people, because it kind of shows that you're understanding what's happening. So then we have validating a behavior as a consequence of learning or as a consequence of genetic predisposition. So this is where the biosocial theory comes back into play, because if someone is just biologically predispositioned to reacting more and being more sensitive, being able to validate that can be helpful. Or whether it's because of this is all that they know, their whole life they've been doing this a certain way. So it makes sense that it's hard and it's not easy to change. So that if we have someone on the unit who's struggling with self-injury, and let's say they haven't self-injured for 3 weeks, and then they relapse and they self-injure again, it wouldn't be helpful, to be like, how could you do that? What's wrong with you? Instead to phrase it in a more I understand this is a behavior that you're working on, and it makes sense that this isn't easy for you because this is something that has worked for you for a long time. And at the same time, we really want to try to work on finding other skills that can be just as helpful for you. So you're kind of validating the fact that this is what they know, and it makes sense that that is what they go to, and you're still holding the other side of the behavior, which is the change piece. You're still holding on to the fact that you want them to do something different without dismissing their initial experience in the first place. So then we have validating the behavior as normative and adaptive given the context. So there are situations where anybody would feel the same way. So a boyfriend breaking up with you, someone dying, not getting into school, your best friend not being your best friend anymore. Those are all situations that make sense for someone to feel sad or feel hurt or feel angry. And just being able to give voice to that and say that that's okay, it makes a lot of sense. I was driving in the car with my son, and he was like, Mommy, I'm really sensitive. And I'm like, that's okay. A lot of people are sensitive. And he's just like, really? I'm like, yeah, of course. you're like Didi Liz is sensitive, like mommy's sensitive. And he's like, I didn't know that Didi Liz was sensitive. And I'm like, yeah, well, you know, like people don't necessarily talk about how they're sensitive, but a lot of people are sensitive. And I could see in his face just like that sense of relief and knowing that like he just wasn't the only one. And so it can be helpful to give that to people sometimes if it makes sense for what the situation is. And lastly, we have just radical genuineness, which is just showing that you're human. You know, if someone's sharing a sad story with you and you get tearful, like that's okay. You know, or if you're really excited to see someone after not seeing them for a long time and your face just lights up and you want to give them a hug, like that's okay. It makes a lot of sense. And it can be very validating for the other person to just have that genuine response, like, and feeling, well, just understood and like, it's nice to see you, or, you know, like it's okay to be sad, and having that experience there. So those are the levels of validation. So technically there are 5 modules. We're going to go over 4 of them. The 5th module is like walking the middle path, and it focuses on like dialectics, it focuses on like learning theory, and it focuses on different dialectical dilemmas and secondary dilemmas within DBT. But it's not like a skill that you teach. They're more concepts that people learn, so it's a little different. So mindfulness is the core of DBT. It pops up in every single module one way or another. And it's really where people, well, one, it's also the hardest one to do. Like, it's asking us to do the opposite of everything that we've been told. Because we're always kind of told to do more, try harder, like keep going. And mindfulness is all about being aware of what's happening in each moment and paying attention to that and doing one thing like at a time. So it's very counterintuitive to just how we are in general. And so you are trying to increase your awareness of your internal experience as they occur. And you're learning how to non-judgmentally and effectively observe, describe, and participate in experiences. You're increasing your ability to focus attention on one thing in a moment. Like, this is really hard to do. And you're learning how to be in control of your mind rather than letting your mind be in control of you. So there are a lot of times when we have all these thoughts come up, you know, and it feels like we can't control them. And it feels just overwhelming, and like you just have no say in what's going on. And mindfulness is about teaching you how to put your mind where you want it to go and putting the spotlight on where you want it to be. So that if you're in class and you need to focus on what the professor's saying, and you're thinking about, you know, whether you have to run errands or cook something or pick someone up, you're letting that go and instead focusing on that one thing that's happening and like putting the spotlight on that. And with the goals of mindfulness practice, it's to help reduce suffering. So you're reducing pain and suffering, decreasing tension and stress, and regulating your emotional responses. It also helps with just increasing happiness. You're able to experience joy more because you're able to notice it more. You're able to participate in it more. You're able to, you know, improve your physical health. There are a lot of studies on mindfulness and its effectiveness in terms of managing chronic pain, which was how it was first developed. So it can be very helpful for that as well. And it helps you with just also increasing your ability to manage the stress. And it helps with increasing your ability to be present in your life as it's happening. So instead of worrying about what happened in the past or worrying about what's going to happen in the future, you're focused on the now and focused on how to make the most of what's happening right now and really enjoying that and being present and connected to the people around you. So that you can enjoy your life more. And mindfulness does this through 2 different skills. And they're broken up as the what skills, which is what you are doing in mindfulness, and the how skills, which is how you do it. You know, and with the what skills, you have observe, describe, and participate. You cannot do them all at the same time. You can only do one at a time. So with observe, you're really just paying attention to what's happening without putting labels on it, without placing judgments on it, and without describing it. So if I was to observe this room, I'm just kind of looking at the blue walls without really labeling that in my mind. I'm just observing it as it is. Once you start describing it, that's when you move into describe. And so it's paying attention to what's happening around you. So if I was to describe something in this room, I'd get very specific about like the color, the shape, whatever it is. And then with participate, this one can be tricky because a lot of the times it's hard to let go of your own judgments and throw yourself into something fully, and that's what it's asking you to do. You know, so if, let's say you're in a group and you're playing this game where you have to just make funny noises and like bounce them off at people. A lot of the time people can be hesitant to do something like that because they're worried they're going to mess up, they're worried they're going to sound weird, they're worried someone's going to say something, however many thoughts may come up. And if you can suspend those judgments and let them go and enter the experience as just what it is, like I'm going to make some noises, I might look like a fool, and that's okay. And being able to participate in that fully. With the how skills, it talks about how you do mindfulness. So you do mindfulness, one mindfully, which is one thing in the moment. You do it non-judgmentally. So it's not that you can't have judgments, because we all have judgments. It's not letting the judgments influence your decisions, and it's looking at them from more like a third person point of view. So there was this staff member who, before we were staff members, we met in orientation. And she was someone who, in my mind, fell into this box of like someone who I would never talk to, and we would never be friends. And if I had stuck with those judgments versus just allowing myself the chance to actually get to know her and, you know, see what she's like, I would have never seen that she's actually really funny, that we actually had a lot of things in common, you know, and that we actually ended up being good friends. I would have missed out on that opportunity if I let my judgments make the decisions for me. So it's really about just noticing your judgments and noticing where it pulls you, and just being mindful of whether that's where you actually want to go or not. And then with effectively, you're looking at what's needed for the situation. It's not about being right. It's about doing what's needed. So if being effective means that you have to go to therapy like 2 times a week because that's what is needed, then that's what's needed. If being effective is like not yelling at someone, you know, then that's what's needed. So it's really just doing what makes sense. It's not necessarily about what's right. It's just about what the situation needs. So then we have emotion regulation. So mindfulness and emotion regulation are probably the most important modules in DBT. Mindfulness helps with just reducing your overall suffering and being able to feel more in control of your mind, and emotion regulation helps with just managing how you are feeling and learning how to recognize what's happening in your body. Because a lot of the times people have a hard time identifying what is happening, like when they feel sad versus angry versus guilty versus shame or fear. And mindfulness helps with understanding your emotions and how they function. It helps with increasing your awareness of your emotional experience. It helps with increasing your control over difficult emotions and increasing your positive experiences as well, and decreasing your emotional suffering. You want to be able to understand the emotions you are experiencing, and Marcia has come up with 3 functions to an emotion, which is to motivate. So a lot of times when we get angry, we want to do something about it. So anger tends to be an emotion that tends to motivate people a lot. They also communicate to ourselves, when we're feeling really sad about a loss. It's telling us something, you lost someone and it makes sense that you're feeling sad. Or they communicate to the people around us, whether we intend to or not. our nonverbal body language does a lot for communicating, as well as our verbal body, like what we're saying. So paying attention to the 3 ways that emotions work and how they affect you and how they come up for you can be helpful with understanding how to manage your emotions. You also want to pay attention to what it is that like triggers you, like situations where you are more sensitive and more reactive, and understanding what is happening for you so that you can do something differently with it. It's very hard to change behavior if you're not aware of what is going on in the first place. It's kind of like trying to drive to Logan, but you're new to Massachusetts and you have no idea of how to get there. It's not going to be easy. Chances are you'll probably get lost and not end up being where you need to be. So paying attention to that. And emotion regulation has several skills that fall under it. So one piece of emotion regulation is identifying your emotions and understanding your emotions. And that's where like mindfulness of current emotion comes in. And the goal with mindfulness of current emotion is to be able to like observe your emotional experience without placing judgments on it, without escalating it, without suppressing it, and paying attention to what your body is telling you. You know, so we ask people to like pay attention to their sensations in their body, because our sensations tell us a lot about what's happening. So if someone's heart is beating really fast and they have like knots in their stomach and their leg is shaking, that's giving us information about what emotion they're feeling. You know, a lot of the times that ends up being fear. You know, and just knowing that you're scared can help you do something about it. Whereas if you're just stuck in like the physiological response of what's happening, it can be very overwhelming. And then you don't know what to do. It's like, what is going on in my body? And how do I fix it? So mindfulness of current emotion allows you to pay attention to what your body is telling you so that you can do something about it. And just in doing it, it can have the effect of also being very validating, because you're paying attention to what's happening and saying like, all right, so my heart's racing, my stomach's all clenched, my leg's shaking, so this probably means I'm feeling fear, and I do have to give this presentation, so it might make sense that I'm feeling fear. So I feel actually a little bit better knowing that like it makes sense that I'm feeling this way versus thinking that I shouldn't be feeling this way and there's no reason for me to. There's also a skill used to target just reducing someone's overall vulnerability, and this is done through ABC Please. And this is where you're accumulating positive experiences. So you're doing fun things now. You're not waiting to do them later. You're not waiting to do them when you feel like you have more time. You're making a point to like do something nice for yourself so that you're just reducing your overall vulnerability for the future. Because life is stressful. Things happen unexpectedly. And just giving yourself like that extra scaffolding and like having fun things to do can be very helpful. Along with that is the B, which is build mastery. And it sounds a lot like what I just said. You're gaining mastery over things that you do, whether it's a hobby or whether it's a subject, or whether it's like knitting or doing like Sudoku, anything like that. You're building mastery and it helps build this sense of accomplishment and people feel good. A lot of the times we have our unit, our girls write goals on the board, and we do that so that at the end of the day, the idea is that they have accomplished these goals and it helps them just feel more confident about themselves and like build up their sense of worth. And the C is coping ahead, because we all need to prepare for life. We don't know what can happen. And when you're coping ahead, you're really trying to think about what could be the worst case scenario. If the worst case scenario happens, what would you do? And imagining that you can actually manage the situation well, whether it goes the way you think it will or whether it doesn't. And just having that in your mind, like taking time out to like imagine things going well, actually has an effect when you do it. And it's been shown to be very helpful with having it be more effective for people if they do spend the time coping ahead, that they feel more prepared when it's actually happening in the moment. Then we have the please piece, which is all about taking care of your body. So you're paying attention to your physical illness and you're treating it like as it makes sense. You're eating balanced. We got 3 meals a day. You're avoiding mood-altering substances and like taking meds as prescribed. Caffeine is considered a mood-altering substance, and a lot of people drink caffeine. So it's not necessarily that you can't have any caffeine, but just paying attention to how it works for you. Then there's sleep, which is very important. We can't function without sleep. It's very hard to do anything. It's very hard to think. It's very hard to just be engaged in what's happening around you. So sleep is very, very important. And then we have exercise, which is shown to just increase serotonin in the brain and help people feel better about themselves. So we try to incorporate like all of these strategies for the residents as they come in so that they can start applying it to their own lives. Then we have opposite action, which is a big change piece in DBT. And it's broken down by the 10 primary emotions. So DBT only has 10 emotions. It's just the way Marcia did it. There are other therapies where there's a lot more. So like CBT, you can say you're frustrated, you can say you're upset, you can say you're hopeless, whereas DBT, you're feeling sad, or you're feeling anger, or it's joy, or it's disgust, envy, jealousy, shame, fear. I don't know if I missed one, I might have. But it's really just paying attention to those core emotions. And what opposite action has you do is look at what urge is coming up and like noticing that urge. And sometimes you act opposite to that urge, and sometimes you have to do other things, just depending on the emotion. So it's very specific based on how you're feeling, which is why it's important that people learn how to identify what they're feeling, because you can't really do any of the other change strategies without that piece first. So there's also the piece of checking the facts, which is a little bit stolen from CBT, where you're just kind of looking at what the facts are, not what your judgments are, or what you think happened, but really concretely just the facts of the situation. And then there's problem solving, which is broken up in 5 different ways that you can problem solve. So you can solve the problem, which is great, not always realistic, but sometimes you actually can solve problems, and that's good. Then you have radically accept the problem, and with that, it's not that you're accepting it. A lot of the times, radical acceptance sounds like, oh, I'm accepting the situation. That's not what it is. It's that you are saying things in that moment cannot change, and they are what they are. And that's what it is for you. Then there's making the problem worse, which you can do. It is a viable option. There's also staying miserable, which is another viable option. Not a pleasant one, but it's there. And then there is changing your response to the situation. And this one is trickier and probably one of the more helpful ones, where you can take a situation and look at it differently and see it as positive. So if, let's say, you are trying to quit smoking, and it's like really, really hard to do, you can look at it as an opportunity to be able to run further, or be able to go upstairs without coughing. So looking at the other side of the situation and trying to find positives in what's happening versus only focusing on the negative. So the third module we have is distress tolerance. And there are the crisis survival skills, and then there's the reality acceptance skills. The crisis survival skills are all short-term solutions. They will not fix how you're feeling for a long period of time. It's just meant to kind of get you through the moment. So we have skills like accepts, improve, tip, self-soothe, half smiling. Those are all things that kind of help get you through the moment, but won't actively change how you're feeling. That's where emotion reg comes in. And then you have the reality acceptance piece, which are things like radical acceptance, being willing over being willful, which can be very hard, because when you're willing, you're just doing what is needed in the situation. And when you're willful, you're kind of focusing on only what you need versus what the needs of the situation are. So when you're trying to be willing, you're trying to balance both what you need and what the situation is asking for, and holding both of those things in mind. Then there's the pros and cons list, which can just be helpful in terms of helping you figure something out if you're stuck. Like if you are trying to figure out whether or not there's a behavior that you want to stop doing. Like doing a pros and cons list on it can be helpful to see just how you really feel about it and where you land on it. And then there's the turning the mind scale, which kind of goes along with radical acceptance, and you're just kind of bringing yourself back to what is needed. Because radical acceptance is hard, and you have to sometimes do it over and over and over again. So a lot of the times our residents will be using radical acceptance around the fact that they have BPD. And like that's something that's hard to accept. And it might take a long time to accept that that's what's happening. And just coming back and turning your mind back to like what the reality is. It doesn't mean you're okay with it. It just means that this is what's happening. And lastly, we have interpersonal effectiveness, which focuses on how to build and maintain relationships. It helps people learn how to set limits and boundaries. It helps people learn how to effectively ask for what they need or want. It helps with prioritizing and organizing wants and needs, and it helps with building mastery and preserving self-respect. And interpersonal effectiveness uses these set of skills. One, which is Dear Man, which is all about getting what you want. So you're looking at describing like the facts of the situation. So let's say you want to ask your parents for a puppy or something like that, something fun. You're stating the facts. You're like, I don't have a puppy. I will be able to have someone to play with. So these are facts. I will be able to go outside and go on walks. I will feel like I have company in the house. Then you're expressing your emotions, So I feel that it would be very helpful for me to have someone that I can cuddle with and lay on and pet and play with. So you're just kind of expressing how you feel about it. Then there's the assert piece, which you're just asking for what you want. So like, I want a puppy. And then there's the reinforce, which is where you're telling the person what they can get out of it for giving you this thing that you want. So it could be that I will do chores for a month, or I will always be the one that cleans up after the dog and like takes it on walks, and like takes it to the vet, whatever it is. So you're looking for ways that it will make it easier for the other person to say yes, essentially. And the man piece just focuses on how you're doing it, the mannerisms, if you will. So you're doing it like one, mindfully. You're appearing confident, because if you're asking for something and you're looking at the ground, or you have your hair over your face, it's very hard for people to take you seriously. And then lastly, there's the negotiate piece, which you don't always want to go to first, because you might not need to negotiate. So you don't want to settle for a hamster if you can get a puppy. So like always keeping that as the last piece in there. And they have like a couple different strategies for it. One is like broken record, so continuing to ask for what you want. So it could be weeks of hearing about this puppy. And then there's turning the tables. So instead, saying, what do you think would need to happen for me to have the puppy? So like putting it on the other person and having them give you reasons to how you can make this happen more likely. So that's kind of Dear Man, that's getting what you want. Then there is FAST, which is all about maintaining your self-respect. A lot of the residents that we have a hard time setting limits. They have a hard time saying no. They feel bad. they feel guilty, they feel like people don't like them anymore. So a lot of these thoughts that come up. And FAST is kind of built around how to help people preserve their own self-respect. And you do that by being fair to yourself and being fair to the other person. You're not over-apologizing. You're not saying, I'm sorry, 10 times within the same breath of whatever the situation is. And you're sticking to your values. So if, you have a value of not lying, you're holding to that. And lastly, you're being truthful. It's important. And it helps with just maintaining your own sense of self-respect, if you're honest. Then we have the skill which helps with relationship effectiveness. So this is the skill that you use to kind of build relationships. And you can use this with anyone. Like, I use this all over the place. You have being gentle. So just the way that you talk to people. You're not like yelling at them. Your tone is not really high or strong, forceful. You're just kind of gentle in how you're speaking. There's acting interested. So sometimes people are talking about things that you really might not care about, and that's okay. And at the same time, if they're important to you and you want to maintain the relationship, you show interest. So it could be that, let's say your partner likes to watch the History Channel, and you could just be bored to death with the History Channel and just don't really care about watching it at all. Now, if you want to help preserve the relationship, it could be helpful to be like, oh, okay, so what's on tonight? Like, oh, that sounds interesting. Oh, I can't wait to watch that with you. Versus, I don't want to watch that tonight. I'll just be in my room. I'll see you later. So you're kind of trying to balance what you want out of the relationship and holding that in mind. And then there's just using an easy manner in just how you say things. Because a lot of the time, how we say things can have a big effect on how the other person hears it. So if I'm telling someone something they don't want to hear, and I'm saying it in a way that's like gentle and light and uses a bit of humor, it can go a long way versus just being very cold and blunt and direct. So if, let's say, you have to like go to bed at 10, and it's like 10 o'clock, like your mom comes, your dad comes, whoever it is, and they're like, all right, it's time to go to bed, and you're just like, there's a show that's coming on, I really want to watch it, like, why can't I stay up later? As a parent, you can take two approaches to this. You can be like, this is it, this is the rule, that you have to go to bed, and that's it. Which might lead to, the child screaming, yelling, saying all sorts of things. Whereas if you're like, oh, man, I get it. It would be nice to watch this show. I understand. It's a good show. Who wouldn't want to watch that? At the same time, that this is your bedtime. So how about we put the DVR on so you can watch it tomorrow and you won't have to miss out on it, and you can go ahead and get ready for bed. So you're just being gentle with them, you're using the easy manner, you're validating their position, and you're acting interested in what it is that they're doing. Interpersonal effectiveness also uses cheerleading statements, which is when you kind of encourage yourself along. You're like, yes, you can do this, or, this won't be as hard as you think it is, or earlier today, I was like, I know what I'm doing. So these are all kind of cheerleading statements that you tell yourself, and it kind of helps with just making it easier to do these difficult things. And then we have the model of direct communication, which we use. It's not like a DBT skill, it's just something that we teach the residents in terms of how to talk to people when they're in conflict. So we have them say something like, when you said blank, I ended up feeling blank. Did you mean blank? So if, let's say your daughter broke up with her boyfriend and you were like, there's so many other fish in the sea. So the daughter could respond by saying something like, when you told me that there are so many other people out there, I felt like it wasn't okay for me to feel sad. Did you mean to say that it wasn't okay for me to feel sad? So it really just helps clarify what is happening and gives both people a chance to like do something about it without like the intensity of like the judgments that come up from thinking that like, oh, they don't think this is important and like it's not a big deal. And instead it's speaking to that and giving each person a chance to like say what's actually going on. So that is kind of DBT in a nutshell. Do you guys have any questions? So DBT doesn't necessarily, so we look at behaviors as having a function. So there's like a function to every behavior. So even something as cutting, it serves a function. You know, it provides relief, it like reduces the distress, it does something. So we try to look at what the function of things are and work with that. So whether we do that through using other tools like behavioral analysis or chain analysis, which really help break down like the sequence of an event so that you can look at like what thoughts came up, like what feelings came up, what sensations came up. It helps give you more information about what's actually happening for you so that you can do something differently with it. You are absolutely right, yeah. That's like the first step, because you can't do something unless you know what's happening. And once you're able to like say, okay, like this is fear, then you move into seeing whether or not that fear is justified. So if it's justified, it means like there's a threat to yourself or to someone you care about. And if it is justified, it's not something that you would necessarily want to change. So if you're in a dark alley at night and you're feeling afraid, there's no reason to change that. Like that fear is there for, it's telling you something. It means to hurry up and get it to your car. You know, whereas if it's unjustified, so let's say you're someone that like struggles with just social anxiety, and it's hard for you to just even be in a room with people, but your life actually isn't in danger. Like sitting in a room with people won't hurt you. That's when you look at opposite action. And so what opposite action to fear is that it has you approach the situation over and over again so that you see that your life is not actually in danger. So that if you can like come into the room and sit down and like see that, you know, nothing happens, you don't get attacked, like you're okay, and you do this over and over and over again, eventually the intensity of the fear goes down because you habituate to it. I mean, and this is where like the skills coach piece comes in with DBT, because a lot of the times you might not know what to do in the moment when you're like feeling that level of distress. And that's when we coach our residents to, on the unit they have staff that they can go to and use as like a skills coach. In outpatient therapy, their therapist is their skills coach on call. So that if they're in a situation where they're feeling afraid and they're overwhelmed and they don't know what to do, they can call their therapist and be like, this is what's going on. And their therapist can help coach them through what steps to take, depending on how they're feeling, whether it's justified, and then like what skills they can use for it. Because it's hard to know what to do all the time. You know, it's hard to expect that from people. So with something like that, it's not something you can do in the moment when you're disassociating. Because when you disassociate, you're not present. So that alone makes it impossible. It's something more that you practice when you're not in that state. So you practice radical acceptance around the fact that due to the trauma that you experienced and where you are in terms of your treatment, disassociation is going to happen. And it is something that can change. You know, there are like tools and skills and techniques that you can use to help minimize like disassociation and help get more grounded so that you're not having that constantly happen. So it's using it more like outside of the specific disassociation as it's happening, so that when it does happen, you can learn how to respond to it more effectively.
Does someone have control when they're disassociated though? Like, I'm just wondering.
Sometimes they do. It's different for everyone, and there's a spectrum in terms of disassociation. Like daydreaming is a form of like disassociation on the very like one end of the spectrum. And then like completely having like an out-of-body experience where you don't feel connected to yourself and you feel like you're looking down on yourself and like that other people are talking outside of you. That's another like form of disassociation.
So help you to practice like mindfulness and and use that in a dissociated state.
So when you're disassociated, what's helpful to do in terms of a skill is grounding exercises. So it's using like temperature, smells, tastes, like anything sensory related to help put you back into the present and get you out of where your mind is taking you. So a lot of the times when our girls are dissociating, we will bring them like frozen oranges and have them like hold the frozen orange, and we'll coach them through like, you know, like you are in a safe place, like pay attention to the cold on your hands, like can you feel the cold on your hands, like can you hear me talking to you? And really just trying to get them back to what's happening now.
It's kind of when you're driving and you're tired and you blare the music and put your hands out.
Exactly, yeah, you want to get the cold in so you can wake up and like kind of be there versus falling asleep, which can be dangerous. Any other questions?
How long does it take to learn DBT as a patient? And it seems like an extensive skill set.
It is. I mean, I've been doing DBT for 5 years, and there's still more that I can learn. It's a way of living your life. It's more than just a therapy. And learning like the straight skills doesn't actually take that much time. You can do that in about 4 weeks. Learning how to apply the skills and internalize the concepts is what takes longer. And that just depends on the individual. You know, some people pick it up more quickly and it really resonates with them and they feel like this works and it makes sense. And for other people it's harder. So there isn't really like a concrete answer for that. So DBT focuses on both acceptance and change. So there is a lot of validation, and that validation actually helps change to occur. So when Marcia was initially developing this therapy, she tried it just first with validation and found that while the patients found it helpful, none of them were actually changing. And pairing that with all these different change strategies that are within DBT is what helps have that push for change. And while it was developed then, it is something that there's still research now that's being done that still shows its effectiveness. So while it might not reflect some of the attachment research, it does still show to be helpful and effective for people in terms of producing change. So that stuff happens in the therapy session. There are, I didn't go over this stuff because this is more stuff that the therapist learns, but there are like commitment strategies that the therapist uses, and there are like therapeutic techniques that they use to help facilitate that process. So it is there. It's not something that gets talked about because it's not really like a skill it's something that the therapist does within the therapy. Yeah. Well, it can feel that way when you hear about it just like being talked about because it sounds very concrete. And this is why I said that while I've been doing DBT for 5 years, there's still a lot that I can learn because there's a lot that goes into it that it's hard to just kind of put words to. But there is like this process of the therapeutic relationship within DBT is very important. And that's where a lot of the change happens. It's between the relationship between the therapist and the patient. And it's used a lot in DBT. So it doesn't get talked about as much, but it is there. So if someone's looking to receive DBT treatment, a lot of times you will want to look into psychiatric hospitals to see if they have outpatient programs that do it. A lot of times you can go on Google and enter DBT therapist and see what pops up. In terms of how their treatment progresses, it just depends on the person. They can be connected to skills groups to help with just the skills generalization piece. They can just do individual therapy. It just depends on what their needs are. Well, behavioral change can happen within a couple weeks of knowing DBT. Learning the skills, depending on just a person's own cognitive functioning and the amount of just the stress that they're actively under. So if they struggle with a PTSD, it's very hard to retain information. So just depending on what their own personal vulnerabilities are, you can actually learn the skills and apply them relatively quickly, 3 weeks, 4 weeks. We generally tend to see change around then on our unit. And it is different for everyone. Well, I want to thank you all for coming. And we're going to have to end because there's another group. Thank you.